These short video clips will show eccentric exercises for tendinopathies involving the Achilles, patellar tendon and wrist extensors. It is important to note that no exercise program should be undertaken without discussion with a medical professional first. Eccentric wrist extensors, slow. This initial video clip shows lowering of the wrist over a 6 to 8 second period without any loading. This video would demonstrate eccentric exercises for tennis elbow tendinopathy. No exercise program should be undertaken without discussion with a medical professional. We will demonstrate two forms of eccentric exercise. We suggest that you start with a tabletop exercise which you can load the tendon by approximately 2 to 3 pounds. This can begin with a water bowl, initially empty, and by gradually increasing the volume of the water inside the bottle, you will progressively load your tendon. Eccentric wrist extensors. This clip demonstrates the same exercise, however the exercise is done quicker. Instead of 6 to 8 seconds for eccentric phase, this takes 2 to 3 seconds. The same prescribed program of 3 sets of 15 repetitions is repeated. It is important to hold the weight in your hand with the back of your hand facing upwards. Use your non-painful arm and hand to lift the weight upwards. Now remove the supporting hand, allow the wrist to be lowered in a controlled fashion. The supporting hand is then used once more to raise the load back to the original starting point. Pain is often experienced during these exercises, and as long as the discomfort is felt, that is okay. However, if pain becomes disabling, stop the exercises and seek medical professional advice. Eccentric wrist extensors, resisted. This second form of eccentric exercise, using a TheraBand, allows higher loads to be used. A piece of TheraBand is tied into a loop and placed underneath the foot on the injured side of the body. The heel of the hand of the injured elbow is placed upon a flexed knee, with the knee flexed at approximately 90 degrees. With the straight arm, the loop is placed in the hand, with the back of the hand facing upwards. The uninjured side's hand is used to lift the wrist upwards. The supporting hand is then removed, and the hand holding the TheraBand is slowly lowered over a period of 2 seconds. The supporting hand is then reapplied, and the injured arm's hand is returned to the starting position. Each exercise should be undertaken for 3 sets of 15 repetitions, with a minute rest in between sets. You will need to do your exercises twice per day, 7 days per week, for 12 weeks to gain maximum benefit. Some improvement may be seen before 12 weeks. After 12 weeks, it is advisable to perform the eccentrics once per day, twice per week. Tendon and muscle soreness is expected during the first 4 weeks.